Lai et al. Have assessed the role of AP and PA views in assessment of non-traumatic aortic dissection. They also included maximal left mediastinal width along with maximal mediastinal width and their ratio. Maximal mediastinal width was the maximal width of the mediastinum at the level of the aortic knob from right to left border. Maximal left mediastinal width was the maximal width from the midline of the trachea to the left lateral edge of the aortic knob. As expected, they found that PA projection was more accurate than AP projection. Left mediastinal width and mediastinal width were the most powerful parameters on PA and AP chest X-rays respectively. Mediastinal width ratio was found to be less useful and less reliable. Optimal cutoff for left mediastinal width was 4.95 cm and that for mediastinal width 7.45 cm in PA view. Corresponding values in AP view were 5.45 cm and 8.65 cm respectively.